Thank you to Eyelids for having me today. This is a great presentation by Katri, and hope I can follow this. So I'm an oculoplastic surgeon. I practice in Westchester, Manhattan. I've had the LightPod Era for many years now. I've treated hundreds of patients with it. I have a lot of experience too in my training with the CO2 laser, and I find that the erbium laser is extremely effective. I'm very risk adverse. It's very safe. As Dr. Katri showed you, there's a lot more issues with the CO2 laser. As an oculoplastic surgeon, I do treat many eyelids in conjunction with Blepharoplasty, and I have no fear of over-treating the lower lids, which can create an issue. If you use a CO2 laser, you can get contracture and ectropia and multiple other issues. Sorry. So I decided that patients with very dark skin, as I said, I'm risk adverse. I was concerned about using an erbium on people with very dark or black skin. So I decided to do a little study on patients with very dark skin using a sub-ablative mode. The benefits of a sub-ablative mode are there's minimal downtime, there's minimal no risk of patients of darker skin tone, and it's very effective, as Dr. Katri said, on people who just want to look refreshed before a social event, or if there's concern about patients who live in a sunny area or are going to be exposed on a vacation to extreme UV light. The ablative mode, as Dr. Katri was saying, is very effective. It gets rid of a lot of sun damage, fine lines, wrinkles, uneven skin tone. If someone has more downtime available, then I'll do an ablative treatment. So I'm going to show you some patients who received a sub-ablative treatment with the laser.
Your sub-ablative is what you refer to as refresh?
Yes. Hello, I'm Dr. James Gordon. I'm an oculofacial surgeon in Westchester, New York, and in Manhattan. I was the first physician to use the LightPod Era erbium laser, and I've really enjoyed the outcomes of the laser and the experience with it. It's very easy to use. I'm very risk adverse, and I do get anxious when there's someone with very dark skin. So I came up with the idea of treating patients with a sub-ablative technique where you don't see such blanching and the white skin sloughing that you get when you're using the erbium laser as traditionally used. So I treated about 10 patients, and it's quite interesting to see how you can still heat up the epidermis, and there's still improvements in the skin texture due to collagen changes, and patients, surprisingly, after just one treatment, felt significant improvement in their skin tone and texture. I want to have you meet some of these patients.
And I noticed after a couple of days, once the healing was done, the color was much more evened out. Also, the skin was much more smoother, tighter, which I really enjoyed.
I noticed that my skin had a little bit of patchiness to it. Too much, but enough that I noticed it along my forehead, around my nose area, under my eyes. I noticed after the procedure, and not just me, but my mom noticed it more so, that my skin looked a little bit glowy. I asked her, "What do you mean by glowy, Mom?" And she said, "It just looks like it has a glow to it." I noticed around my forehead that my skin was definitely tighter. I noticed around my cheeks area, it was definitely tighter. Some of my coworkers also noticed it as well. And I think it was a great experience. I would do it again, definitely. I think the results came out wonderful. I noticed that I had some lines in my forehead. That was my biggest concern around my forehead. I don't notice them as much. And also with between my eyes, around my nose area here, it has a little bit of a line. I don't notice it as much. So I think I just look more vibrant and younger. So I think it did its job.
With the results, probably about maybe 2 days after, I noticed that my skin was more even and it had like a glow to it, which it didn't have before. So I was very satisfied with that. I was very happy with that. And actually, people that I know, they would ask me like, "Oh, what foundation are you wearing?" Like, and I'm like, I'm not a girl that wears makeup every day. I just don't. So it was just like such a compliment to me that I just looked like I was wearing like a full face of, foundation and cover up when I didn't. My skin was much more even tone.
I'm of a certain age, so I thought my skin needed to just be a little bit smoother and it felt like it was a little rough. And so after I had the first treatment done, I started noticing my skin started just felt smoother. After the second, it was smoother and lighter, and it just brighter. It just made me feel good when I had it done.
Did any friends or family notice any difference to your skin?
One of my friends did. One of my friends says, I don't really like to talk about what I do to my skin. I prefer people, if they've noticed something, then they'll say it. But one of my friends did. She noticed that my skin she kept asking, like, are you doing something new? Are you applying a new makeup? And I said, why? And she goes, because your skin is very smooth. I said, no, I'm doing a new laser treatment. And she said, oh, okay. And she knows that it was smoother and brighter too. She did say that.
With the initial pulses, I get closer than necessary and I ablate, and then I pull back from there. I go right at the point where I don't see any more ablation, where I don't see whitening of the skin. When you see a little bit of the whitening, you know that the skin is being ablated, so I pull back a little bit from that point. If you want to do a little ablation, one area where there is an area of acne, you can do ablative mode. You just go closer. So you can tweak it. If there's a sensitive spot, you can pull even further away. So it's easy to tweak the treatment without actually changing any settings. It's just a matter of how close or how far you are from the patient's skin. You want to make sure the skin is dry in order to get the treatment done that's necessary, because water will absorb the energy. So you need to make sure the skin's very dry, and then you can play with it. If there are times you see a patient's a little moist, you may have to go a little bit closer than you would expect to. If the patient has a little bit of erythema, I tend to feel like that's a good place to stop. If someone's looking to be a little bit more aggressively treated, then instead of doing 2 passes, I'll do 4 passes on their skin. There are some people who say, do the maximum you can do. Well, in that case, then you're going to do ablation. But for patients with darker skin, you can easily do 4, even 6 passes in a non-ablative mode, and there are no issues with that from what I find. Immediately the skin looks a little bit shiny. When you look at the right side compared to the left side, you can see with just 2 passes, non-ablative, her skin has a little bit of a glow to it. Usually in darker skin, I'll do 4 passes if it's very dark, or 2. It depends actually on what the patient's looking for, how their skin looks to start with, how dark they are. You might be a little bit more anxious on someone who has very black skin. You may want to start with 2 passes. And on someone who has lighter skin, do 4 passes. But also if there's a lot of, Kim happens to have fairly even pigmentation except in her forehead and her chin, so those spots I might actually be more aggressive on and do 4 or even 6 passes. Someone with acne, you probably want to do with 6 passes. Someone who says, oh, you know what, I'm going to be in the sun in 2 weeks, you want to only do a couple of passes. You don't want to treat someone aggressively prior to being in a sun. So the laser is great because you can tweak it, and you really don't have to be over anxious about over treating someone. There's not much risk involved in doing, even if you performed an ablative mode, which I'll show to you. But sub-ablative, I find that most of the people I treated said they just lived their lives and either noticed a little bit of erythema for a couple of days. If I was more aggressive, they tended to have a little bit of peeling of the skin a couple of days later. But everyone said by day 3 they looked completely normal and already felt that they had a bit of a glow to their skin, which seemed to increase as time went on, as the additional treatments took place. So this patient already had upper blepharoplasty, and now I'm performing the resurfacing. I use an energy of 1.0 and a fluence of 1.5. In a thicker area of skin, I'll use sometimes 4 to 6 passes. I probably fluctuated on how much I use on this patient because I'm never consistent. I basically treat the area based on how the skin looks. So on a cheek area, which is thicker and sun damage, I might do 6 passes, whereas by the ears, where there's not so much sun damage, I may only do 2 or 3 passes. This is after all my patients. I know there are different products on the market. I always use Aquaphor, and they look horrified when they look in the mirror immediately after. But then as you see 4 days later, they already start to look better. So you can see how fast the healing is with resurfacing. Yeah, the vertical lip lines are a great area to treat. For the deeper upper lip lines, I tend to use multiple passes. I'll do 8 passes when the vertical lines are very deep. But you get a very good tightening effect with the erbium, as well as, for me, the main thing is safety. And it's very safe, it's very effective, and it's very cost efficient for the patients as well. And it's great to use as an adjunct to fillers or to Botox or surgery. Yes?
Okay. So this is a patient who we did a kind of a combination treatment. She had a mini facelift, and she had a variety of things, which included some fine wrinkles, some solar lentigos as well. We used the erbium at the same time with the procedure. Of course, she's a lighter skin type too, and the patients healed very quickly, so we combined this a lot with surgery as well. And this is just the patient from the other view. This patient is now 4 months out. So it does show that the collagen does indeed remodel. And when you're talking about when is the patient going to see kind of the final result, their skin gets better even after 4 to 6 months with things. And so in this patient, you can see a variety of different conditions that was all treated as well. So in my hands, the erbium works very well. It has less downtime than the CO2, and from Dr. Gordon's talk, using the sub-ablative mode is something I haven't personally done, but I'm certainly willing to try that as well. So in summary, if you're going to switch from doing your non-ablative treatments to going into ablative treatments, you have to be prepared to deal with wound care issues, infections, herpetic outbreaks. It's a whole different ball game when you go from going from the neo, and now you're going to maybe add ablative resurfacing to your practice. But in my hands, it's very well worth it. And so I just was showing one case for that, and I'll take any questions if there are. Otherwise, it's getting late in the day. Thank you very much.
You said mini combined with Aero mini facelift?
Yes, this patient had a mini facelift with, we do the surgery first, and then we do the resurfacing right after. And the other thing is that we're very comfortable in using the erbium over the skin flaps that have been dissected. Typically we're, in this case, just deep sub-Q just above the SMAS, and so the blood supply is still good for those patients. There's been a number of publications with the use of fractional CO2, for example, combination with facelift, and if you have a patient who's a non-smoker or relatively good skin quality, you can combine some sort of ablative resurfacing with surgery at the same time. The advantage here is that everything's done at the same time, so the patient's going through one recovery period. Okay, great, thank you.
So I am the director of Park Avenue Facial Aesthetics, and my education is went to Northwestern University 6-year honors program, and that was followed by a residency in ophthalmology at Stanford, then followed by an ASOPR's accredited fellowship with one of the founding fathers of Oculoplastics, Dr. Orkan Stazier, up in Albany. During my fellowship in 1996-97, I believe that was the year that the FDA had approved the CO2 laser. So my interest in laser technology was piqued right at that time as Dr. Stazier. We got our hands on one and we did a bleph, one side with scalpel, the other side with laser, and the rest is history. When I began my practice, I was convinced that laser technology was the way to go, the wave of the future. And so I began my practice with CO2 laser blepharoplasty. Again, at that time, I was using continuous wave, the ultra pulse. And while I used the CO2 for incisional surgery, I also saw during my fellowship the CO2 being used for ablative resurfacing. And the patients we did during my fellowship year had prolonged erythema, demarcation lines, and on and on and on. So I was very, very scared by that, and I've never used a CO2 laser for resurfacing thereafter. So I My practice is pretty streamlined. It's a very boutique type practice. I focus mostly on the face. I do a lot of blepharoplasties. I also do a lot of Festoon repair, and I've developed my own technique to address and treat Festoons for the short term and the long term. And we do a whole host of skin treatments, of which I believe erbium YAG laser resurfacing is a mainstay in my practice. I acquired my first LightPod Era in 2006 for my Westchester office, fell in love, and then I acquired another one in 2012 for my Manhattan office. Over the last 12 years or so, I've done close to 10,000 resurfacing treatments. I use it as a standalone procedure, and it's also an excellent adjunct to my Festoons, my Blepharoplasties, and I also do Mini-Facelifts. I won't belabor these points, but basically I call them the 4 C's of lasers: collimated beam, coherence, color, and obviously chromophore. And if we zip down to the bottom, the importance of that equation is that the laser energy is inversely proportional to the wavelength. So the greater the wavelength, the less the energy, and vice versa. Okay, so why the LightPod Era in my practice? I think it's superior for superficial skin rejuvenation. And as I mentioned earlier, the CO2 laser is just not my cup of tea. With its 300 microsecond pulse duration, and which is less than the thermal relaxation time of skin, and it's 2940 nanometer wavelength, pardon me. It's got a very high affinity for water, and as Dr. Khattri said, 10 times that of the CO2 laser, which means that we deliver less energy, and it's less painful to the patient with fewer complications. This is just my technique, which I don't have to belabor that. But we do full face as well as segmental parts of the face as well, depending on the patient. And in my practice, these are indications for erbium YAG laser resurfacing. One thing I want to point out is that I am a huge fan of using my LightPod Era for surgical incisions, and I find that they can be fresh or they can be old, treating the laser scars, treating the laser incisions with the erbium YAG does minimize and oftentimes preempts scarring. And these are the contraindications. This is just what we charge. It's average. Sometimes it's more, sometimes it's less. But these are our pricing parameters. So I'll just go through a few of my surgical and laser treatment results. This patient had combination therapy, laser upper and lower blepharoplasty, and erbium YAG laser Festoon repair. She did not have a direct Festoon repair. The Festoons were treated solely with multiple passes done in one session with the erbium YAG. This is just a close-up. This is another patient, combination treatment, laser upper and lower blepharoplasty. She did have a direct Festoon repair, as well as erbium YAG laser resurfacing as an adjunctive therapy. This is picture left is before, 9 months after, and 4 years after. The key with Festoon treatment is you want longevity and a long-term result, because when Festoons, especially lymphedema Festoons, are treated solely with the laser, they can recur. But done in conjunction with a direct Festoon repair with laser resurfacing, it makes for a great result, short-term and long-term. And these are both no-flash photos. the before photo demonstrating the degree of the Festoon, and the after photo is 4 years later, and you can see that the Festoon has not recurred. And these are just profile shots showing the lack of reappearance or the lack of recurrence of the Festoon even 4 years later. And you can see that treating the lower lid skin with the erbium YAG during the post-op period, we do several treatments, and then it becomes a maintenance treatment too. Once a year, patients will come in and have an erbium YAG resurfacing done to keep the skin, especially of the lower lids, sort of rejuvenated, has been very, very beneficial in my practice and for my patients. This patient had underwent laser upper blepharoplasty as well as full face erbium YAG resurfacing to help even out her complexion. And this is after a single treatment. You can see there's some improvement of the fine ritids too, but I generally do neuromodulator for muscle ritids. This is for acne scars. This is for Mohs scars. And this gentleman had also combination treatment, lower blepharoplasty, in conjunction with cheek filler, as well as erbium YAG resurfacing treatments. This patient had full face resurfacing for fairly stubborn sunspots, very diffusely spread over her face, and here she is after 2 treatments. There isn't a complete resolution, but there is a significant improvement, and she could probably benefit from 1 or 2 more treatments. This patient had laser upper blepharoplasty and full face erbium YAG resurfacing, and there is a significant improvement, reduction in her pore size, which she was thrilled about. This patient had, again, combination treatment, and you can see she looks better 8 years later than when she first came to me. So she underwent upper and lower laser blepharoplasty, as well as a whole host of skin treatments, which included, over the 8 years, laser genesis, IPL treatments, microneedling, PRP, as well as erbium YAG laser resurfacing. And I think her skin, she looks even better now than the picture from 8 years. So that picture was taken 4 years ago, and she looks even better now. It's just a close-up. This patient also had combination treatment, upper blepharoplasty, lower blepharoplasty, as well as a left upper ptosis repair in conjunction with full face erbium YAG laser resurfacing. And you can see there's just an overall brightening and evening of the skin tone. And there's a close-up. So in conclusion, I think the LightPod Era offers excellent advantages for your practice. It's portable. It's easy to transport from room to room or office to office. No painkillers or sedatives required, and we only use topical anesthesia. It's easy to administer the treatment by the physician, and in my practice, my illustrious nurse, Amelia, does all the treatments. I think it's a great source of supplemental income. And for the patient, the benefits are, it's convenient for them, it's in office, no hospitalization required, it's virtually painless, rapid recovery with no oozing, demarcation lines, or prolonged erythema that I saw with the CO2 laser. The results are safe and natural, and oftentimes 1 treatment suffices. Thank you very much.